skin color. First, we have melanin. Melanin is the most significant factor of skin color. It is produced by melanocytes. Darker skinned people have more melanocytes, while lighter skinned people have less. There are two different types of pigments: eumelanin, which creates a brownish-black color, and pheomelanin creates a reddish-yellow color. Next, we move on to exposure. Exposure to UV rays stimulates melanin and darkens skin. When UV rays go away, skin lightens. There are other main factors that affect skin color, such as hemoglobin, which creates a reddish tint because there is more blood flow to the area. Keratin also creates a yellowish-orange color on the skin, which occurs from eating too much of the substance. Cyanosis is a lack of oxygen which causes the body to turn blue. Erythema is an infection that causes redness due to the increased blood flow. Pallor happens when you go into shock, which causes paleness due to the decrease in blood flow. Albinism is a genetic lack of melanin which synthesizes enzymes, so people tend to have milky white skin and bluish-gray eyes because they do not produce any pigment. Jaundice is a condition that causes yellowing in the skin from extra bilirubin in the blood. A bruise on the skin is called a hematoma, which is caused by clotting blood under the skin.
Other visual differences in skin include skin markings. Friction ridges are markings on the fingertips that leave fingerprints on surfaces we touch. Flexion lines or creases are lines on the flexor surfaces of the digits, palms, and wrists and elbows. Freckles are small flat spots that are tanned to black, while moles are also tanned to black but bumpy or rigid aggregations of melanocytes. Birthmarks are skin markings called hemangiomas, which are patches of discolored skin which are caused by benign tumors of dermal capillaries.
It is very important to check your skin, more specifically moles. You can use A, B, C, D to check. A stands for asymmetry, B stands for border, C stands for color, and finally D stands for diameter. If you detect changes in any of the following classifications, please contact your doctor immediately. Check your skin frequently.
Take a good look at yourself. Oh, yeah. And turn. Oh, very nice. Check that smooth backside one more time. No, really, check it. Do you see any changing or suspicious spots? It's your skin, and it's important. If you're a man over 50, you're in the group most likely to develop skin cancer, including melanoma, the cancer that kills one person every hour. When detected early, skin cancer is highly treatable. Check yourself out and find someone else to help. Learn more about what to look for at spotskincancer.org. A message from the American Academy of Dermatology.
Hair, another part of the integumentary system, is also called pilus. It is a slender filament of keratinized cells that grows from a tube in the skin called a hair follicle. There are three types of hair. Lanugo, which is a very fine and unpigmented fetal hair. Vellus hair is fine pale hair that replaces the lanugo by the time of birth, and 2/3 of the hair in women is made up of this type, but only 1/10 of the hair on men is vellus, and all of the hair on children is vellus. Terminal hair is longer, coarser, and more heavily pigmented. Eyebrows, eyelashes, hair of the scalp, and pubic hair is made up of this, as well as male facial hair and male leg hair and male trunk hair. There are two conditions that cause you to lose hair: alopecia, which is thinning or baldness of hair. Pattern baldness is hair loss from certain regions more commonly found in men and referred to as male pattern baldness. The function of the hair is to alert yourself of anything crawling on the skin. The scalp hair holds in heat and protects against the sun. There are guard hairs located in the nose and ears. The nose hairs filter the air you breathe in, and the ear hair protects you from foreign objects getting in. Eyelashes and eyebrows allow for nonverbal communication with facial expressions. They also keep sweat out of your eyes.
According to the Harley Street Hair Clinic, the growth cycle of hair consists of 3 stages. The first stage is the anagen or growing stage. The anagen stage is the growing period of a hair follicle. This stage typically lasts about 3 to 5 years. The second stage is the catagen or intermediate stage. The catagen stage is the intermediate period of hair growth. Hair follicles prepare themselves for the resting phase. It lasts around 1 to 2 weeks, and during this phase, the deeper portions of the hair follicles start to collapse. The final stage is the telogen resting or shedding stage. The telogen stage is the resting and shedding period of the hair cycle. It usually lasts 3 to 4 months. At the end of this period, older hairs that have finished their life will fall out and newer hairs will begin to grow.